Have you ever wondered how we remove a cast from a patient's leg? In this video, I'm going to demonstrate how we use what's known as an oscillating saw to remove a fiberglass cast from a patient's leg. So let's first talk about why do we use casts? What's the difference between a fiberglass cast, a plaster of Paris cast, which we don't use anymore, and then there's a walking boot or a cam walker. Now typically we'll use a cam walker in most patients today after surgery or just to immobilize a broken bone in their leg or their foot, because it's easy for them to take off and shower and still get their foot wet, whereas when you're wearing a cast, you can't remove it. It's not simply removable. You can't check under it to see if anything's rubbing or creating a wound, and it's just a little bit easier for the patient, more cleanly as well. What we're doing here, though, is removing a cast from a patient that had surgery, and sometimes we'll still use them on patients that are non-compliant, or they simply just want their leg to be left alone and they don't want to touch it and let things heal. And the way that we do this is we use what's called an oscillating saw, and that saw just kind of vibrates back and forth. It has serrated edges on that round blade that you see, and we'll cut through the layers of fiberglass on either side of the cast. So we're performing an L-type cut on one side of the cast, and then we'll flip the leg around and do the same thing on the other side of the cast. Now, the first thing you're probably wondering is, well, what happens if you push too hard and you hit the skin on the patient? Well, there's a couple things that help with that. One is there's a tremendous amount of cast padding under the fiberglass, and that padding helps to do a couple things. It pads the cast so that you don't get any ulcers or abrasions or anything wearing down. You can see I'm actually touching the saw blade there and it's not cutting me. But that cast padding will help prevent any blisters from occurring or any worn out areas on the skin or pressure from the cast. And it also helps when we're cutting off the cast that it provides a layer between the fiberglass and the skin. So as soon as that blade pushes through the fiberglass, we'll hit that padding and we know we have some space between the skin, and then we can pull back. Now the other thing is the way that this saw is oscillating, it won't cut the skin unless it's left against it for a longer period of time. And that's what I was showing with my hands. And this is one of my favorite parts when we actually pop the cast open. We use a tool that kind of just pops apart the cast. We do it on one side, and then we'll go to the other side, and it gets inserted and pops it open. Now you can see here we didn't actually cut through all of it because we're trying to pop it, and it's not moving. So now what? Well, we're going to have to get that saw back out and cut through any layers that we missed. And that's what we're going to do here. We got our oscillating saw back. You can see we're bracing our index finger from our other hand against the cast so that we can provide more precision with the amount of pressure that we're putting on the cast. And then once that's cut, we go back, pops right off. We'll use a pair of protective scissors to cut the stockinette and padding away, and we're all done.